Hello, everybody, and welcome to another week of Excuse Me, Doctor. My name is Dr. Melissa Clarke, and I am delighted that you have joined us tonight. Thank you so much for being here. And I want to welcome you as part of the Be Health Empowered family if this is your first time joining. So if you're on Facebook, please remember to hit like. And if you're joining us on YouTube, please remember to hit subscribe. Now, we are here each and every Monday night, and our whole purpose is to bring you facts and figures and science to help you make the right decisions when it comes to your health, the health of your family, and the health of our community. And we don't really deal in a whole lot of speculation and misinformation. Our goal here is to actually debunk that. We actually have a weekly debunk. We're going to be bringing that to you really soon. So, the whole purpose of Excuse Me, Doctor is to get you to be able to feel comfortable asking questions. So, I hope that you remember to put any of your questions in the chat, and we're going to be getting to them during the course of the show. I am really happy to bring in my co-producers so that we can go over the week that was in the weekly recap when it comes to our health information and what we need to know. So, coming live from the West Coast, we have Miss Lila Mays. And
Hey.
right here on the East Coast, Mr. Wayne Bruce.
Hey.
Welcome, y'all. Let's
Up,
get
Dr.
to
Mel?
it.
All right,
Hey.
let's get to it, Dr. Mel. So, as we always do, we'll start with the numbers. Dr. Mel, spring has sprung. So, what does that mean for COVID cases?
Well, we are moving on up. We're at 31 plus million cases. And unfortunately, we're moving into what looks like a fourth surge. Now, we're hoping that it's not going to be as bad as the previous ones because almost 1 in 5 Americans are vaccinated. But that's still 4 in 5 Americans who are vulnerable. And, we got these variants going around from the UK and Brazil and South Africa, which are more infectious. And so they can even reinfect those people who've already had COVID. So please remember to double mask, distance, avoid crowds, and even avoid family who you really don't know where they've been.
Indeed. And what are we looking like in terms of deaths?
So we're at 568,765 souls who have lost their lives to COVID. The good news, I guess, is that we've moved from a high of 4,400 deaths a day in mid-January down to about 800 deaths a day. And I can't even say only because 800 is still a huge amount of people who are still dying from COVID-19.
Wow. All right. And a bright spot, how many people have gotten vaccinated?
We are rolling with the vaccinations. 4 million a day is what we hit over the weekend. Yeah. Wow. And so, like I said, about 1 in 5 Americans are vaccinated. That's over 56 million people. That's fully vaccinated. People who've gotten, including one dose, 143 million people. And there's some states that are doing a great job, like New Mexico, number 1, leading the states in terms of the most people vaccinated or the most vaccines distributed of what they were given. And then we got some that are still bringing up the rear, like Alabama and Georgia and Utah, which is the worst states 3rd week running.
Wow. Trophy for the worst.
Yes.
So
exactly.
Dr. Mel, I got a call earlier this evening. A friend of mine who wanted to know the difference between the two tests, whether a rapid test or a PCR test, because they were going out of the country. They were trying to make plans to go out of the country. And one test came up a little wonky, and so they called me. Who else? I'm the expert. So what do I do? I need to ask you.
So this is a deal, and it was a great question. So, there are 2 main kinds of COVID tests to see if you have COVID. One is the antigen test or the AG rapid test. You get the results back in minutes. But then there's this other test called the PCR test, which is the more accurate of the 2 tests. And the antigen test, the rapid test, is especially unreliable when somebody has no symptoms at all. They just want to check and see if they have COVID, like if they have to go out of the country or travel. So this is how the numbers sound. It's 75% accurate if you have symptoms. If you don't have symptoms, it's only 50% accurate. That's like a 50-50 chance. So the best time to get that rapid AG antigen test is only if you feel sick and you want to make sure it's not COVID. Any other time you're traveling to go see grandma, you're traveling internationally and you're required to have it, or let's say you were hanging out with your friend over the weekend and she calls you a few days later and says, hey, I have COVID. I just want you to know, and you need to go get tested, but you don't have any symptoms, get the PCR test. Do not get the antigen test.
Okay.
Okay. So in the vein of traveling, what does being fully vaccinated mean in terms of travel? Does that mean we can fly all around the world now?
So yeah, that's a good question. The CDC just came out with an update. If you are fully vaccinated and you're traveling in the United States, you do not need a COVID test to go from one place to another. But if you're internationally traveling, even if you're fully vaccinated, you must have a recent negative COVID test to get on board the flight to come back to the United States. And then many countries are requiring a negative test in order to enter their country. So you need to be sure when you're traveling that you get that PCR test before you leave the United States to enter another country. And when you're leaving that country, get a PCR test before you come back to the United States, or you might not be able to board the plane. And then any body who is traveling, vaccinated or not, still needs to wear a mask, social distance, and practice really good hand hygiene.
Okay. So look, a friend of mine who's probably watching posts a lot of stuff about different things. But it's a friend that comes on, a friend of his comes on the page and always is negative about COVID and didn't believe in it and doesn't believe in the vaccine, but recently said he got COVID and he was cured by using ivermectin.
Yeah. So a lot of people don't know about this ivermectin thing, but it is a medication that is specifically to treat parasites and worms. And the same doctors who are out here promoting hydroxychloroquine as a cure have also been promoting ivermectin as a treatment for COVID. But that bubble is about to be busted because the WHO, World Health Organization, just came out and recommended against using ivermectin in patients with COVID-19 because there is just simply not the data. And it's not because they're not trying. There have been clinical trials all around the world. There's some still going on, but the ones that have finished thus far are all concluding the same thing. Ivermectin does not work to prevent COVID, nor does it work to treat COVID at any stage. So you can let your friend know that.
Yeah, maybe that friend is watching. So, Dr. Mel, there's some interesting data about one of the vaccines, Pfizer. Can we talk about that and, what it means if you've gotten that Pfizer vaccine?
Yeah, so Pfizer came out with this data. And remember, Pfizer was they started their trials the first out of the gate. And so they're going to be probably giving us updates earlier than Moderna and Johnson & Johnson just because they're further along in the process. Doesn't mean that they're any better than the other two. So we got some news from them, and that's that at 6 months, the people who initially enrolled in their trial are still showing immunity. It doesn't mean that immunity stops at 6 months. It means that you have immunity for at least 6 months and counting. We're going to get more updates from them because they're going to be following people who are enrolled in their trial for a total of 2 years. So we're going to be hearing, periodically from them as to whether immunity is still lasting. But right now, at the 6-month mark, we know for sure that those people who were initially enrolled in the trial still have immunity. So that's great news.
Great news.
So
news.
we're finished the recap. So you know what's next. You do know what comes next, right?
It is the weekly debunk time.
Here we go.
The weekly debunk. Stopping misinformation in its tracks.
So, girl bye texts me for some reason. She said, I ain't taking the vaccine because it's killing folk. And I heard over 1,000 people died from the vaccine. And I don't get sick anyway.
Yeah, girl, bye. I don't know about that. Excuse me, Dr. Mel, is that true?
Well, no, it is not true, but the numbers are actually accurate. So those numbers are from a database that was set up by the CDC to report events that occur after vaccination. But that doesn't mean that those events were caused by the vaccination. For example, one death reported was after a car crash that occurred sometime between the date of vaccination and the date of death. So more than 1 in 3 Americans, 143 million people, have gotten at least one dose of the vaccine. And there is going to be an expected number of deaths, unfortunately, when you're talking about numbers that massive of populations. The important thing to know is that after vaccination, there is no pattern of increases in death or increases in sickness over what normally is expected to happen when you're talking about 143 million people. So to date, the vaccine remains effective and safe.
All right.
So that is our weekly debunk.
All right.
And I know you all know that I have a really special guest tonight to talk about what we call Blaccinated. That's vaccines in the Black community. And I was really fortunate this weekend to participate in a mass vaccination event in a predominantly Black neighborhood in Washington, D.C., Ward 8. It was on Easter Saturday. It was many of the local universities, Howard University, George Washington, Georgetown, the Rodham Institute, which is part of GW, put it on. It was at the Southeast Tennis and Learning Center, where the widow of our former mayor, Marion Barry, her name is Cora Masters Barry, they spearheaded it. And then the Black Coalition Against COVID-19, of which I'm a co-founding member, also helped to make sure that this got pulled off. It was extremely successful. I don't know who's out there saying that Black people don't want to get vaccinated, but there were almost 1,000 people that got vaccinated that day. And you know, one of the things that I did was I talked to people who were a little bit unsure and just needed their questions answered. And I had the honor of talking to a 72-year-old woman. I will change her name to Wilma. And she was a little concerned, but I was able to talk with her. And she finally, after about 15 minutes, said, okay, I'll get the vaccine, but you got to hold my hand. And so I held her hand through the whole process. And, you know, I really applaud the public health authorities like the one in DC that are effectively pivoting to make sure that events like this can happen in underserved communities, predominantly Black and Brown communities, to ensure that Americans who need these vaccines the most have equal access. So tonight, I am really happy to welcome my guest to talk about this and other topics, including his own vaccination, Reverend Dr. Michael Eric Dyson, who needs no introduction, I know, for many of you, but for the 2 or 3 people listening who might not have seen him on CBS or MSNBC or CNN or read one of his 20+ books, he is an innovative scholar, a distinguished university professor of African American and diasporic studies, as well as a professor of divinity, and he is an ordained Baptist minister who focuses on race, religion, popular culture, issues of contemporary urgency and relevance to the African American community. And tonight, we also found in the show Tech-In that he can sing. So welcome. Welcome,
Thank you,
Reverend
Dr. Clarke.
Dyson. Thank you so much for being here.
This opportunity. It's great to be here with you.
Absolutely. Well, you know, quiet as is kept, Republicans have emerged as the most vaccine-resistant demographic group in the United States, followed by white evangelical Christians and rural residents. Black people started off extremely vaccine hesitant, as we know, but we've had a significant change in the last few weeks. What do you think are some of the factors that make more Black people turn out to get vaccinated?
Well, first of all, thank you for having me on your show. Thank you for the extraordinary work you do. And thank you for covering my identity as Wilma, calling me Wilbur. I appreciate that holding my hand and getting my vaccine. That's what you want. Anyway.
No, you're not a 72-year-old woman, so we know it wasn't you.
But look, I think more knowledge is important. Black people are not afraid of science, right? We're afraid of scientists. We're not afraid of medicine. We're afraid of doctors. That is, technicians, medical doctors, scientists who have abused and misused Black people by forging a connection between scientific discourse, scientific rationality, medical knowledge, and hurting Black people. So there is an identifiable history that we can point to suggest that this is the reason for Black skepticism. But when Black folks start seeing, as you say, getting the vaccine, that's what I was calling it. I'm glad y'all calling it too, because I was like, vaccine, let's do it. So when Black people get the vaccine and they see their mama had it, and ain't nothing wrong with mama, and my mother is 84 years old, she put me to shame. I was like, well, dang, she done went, ain't nothing happened to her. Oh, I can't let her outdo me. So as Black people began to get knowledge and information, right, it began to tamp down on our skepticism, our paranoia, our conspiracy theories, and we began to absorb the knowledge, absorb the vaccine, understand, you know, what was going on when we have very prominent physicians like you, Dr. Clarke, and other PhD researchers like Kizzmekia Corbett, who was critical in founding the Moderna vaccine. When we have brilliant Black women like you and Dr. Corbett, it makes a difference. People then begin to believe, all right, well, you know, they were in the mix. They're involved. Dr. Clarke is out there getting Black folk vaccinated. All right, it can't be that bad. Let me at least give it a shot, literally. Let me be open to the vaccine. So I think that knowledge has played a part in it. I think the message has gotten out in many of our churches where Black people obviously still go in mass, and if not physically, then in virtually. And then I think beyond that, watching the disproportionate way in which Black people are subject to death as a result of catching COVID. And enough Black people have died for Black people to go, well, I might as well take my chance. They say I might, you know, get sick taking that stuff. I'd rather be sick a little bit and down than dead. So I think those factors together have resulted in an erosion of Black skepticism and a beefing up of Black determination to be healthy and to be free of this disease.
No, that's well said. And over 80,000 Black people have died from COVID. And you mentioned ministers. I think ministers have definitely stepped up to the plate. Yourself being one, maybe you could tell us about what happened with your vaccine experience. First of all, what made you decide to get vaccinated?
Well, this woman named Dr. Melissa Clarke called me up and she said, boy, have you been vaccinated yet? And, you know, I had been interested in, you know, presenting a strong message of Blaccinated, of vaccination for Black people, because too many of us are dying. Too many of us don't have access to health care. Too many of us don't have access to even getting tested. And so I wanted to make certain that I did my part. So when our good friend, Dr. Sebo Kasai, called me up and then connected me to Dr. Melissa Clarke and said, hey, do you want to get involved and you want to get a vaccination? I said, hecky, yeah, because I haven't had one yet. And I'm 62 years old. And even though I've lost, 24 pounds, I got some more pounds to lose. So I'm overweight.
Congratulations.
Thank you, Doc. I appreciate that. But 62 years old, I'm like, man, I need to get that vaccine as fast as I can. So I connected with Dr. Clarke, and she made it possible. She took me down to the church, and I was kicking and screaming, oh, Lord Jesus, help me, help me.
Hardly.
And Miss Brown, my assistant, was popping me in the head. Get on over there and get in line and stop cutting the food. So, because even when
she was no nonsense. She was no nonsense. She made sure that you were there on time and got it done.
Dr. Dyson, you must now go. And then look, even when Black women work for you, you working for them. That's the bottom line. And I'm working basically for Miss Brown. So when we got to Pilgrim Temple, and it was well organized.
It was Pilgrim Rest Baptist Church.
Right.
Yeah.
Right. Pilgrim Rest Baptist Church. I'm sorry, Pastor. So Pilgrim Rest Baptist Church, a tremendous pastor, well organized. They had their stuff together. So I was able to go pretty much first because I had gotten there early. It wasn't no, special treatment. I hope that I got there and got in line and was ready to go and took my vaccination. And I tell you, it was beautiful. I got a shot. I barely knew I had a shot. I mean, later on, I had a little soreness, but not much. Mm-hmm. And then Dr. Clarke watched me because I was like, hey, don't, hey, watch me now. Watch me. I got
and
it.
Yeah, that was standard. Everybody has to be watched for 15 minutes if you don't have a history of allergies. Yeah,
right. I have an allergy going. So I said,
exactly.
Let me get
30 minutes
15.
total. Yeah.
Right. So I gave a little speech, talked to people, took pictures, and it was beautiful. And it was beautiful to see Dr. Clarke and her compatriots, her medical compatriots out there putting shots in Black arms, making sure that Black people were getting vaccinated because, again, what did you say? The number was 555,000. I don't know. What is it now that we're up to?
Yeah,
people
568,000 plus.
568,000. You said 80,000 of whom are Black people.
Black.
I mean, disproportionate numbers in the ways in which we die. So I was more than happy. I got my first shot. Looking forward to getting my second shot, later on this month, and to make certain that I do my part to advertise and publicize the value and the health of getting vaccinated, because we got to do it. My 84-year-old mama's vaccinated. I'm vaccinated now, so I'm trying to get everybody vaccinated out here so we can survive this horrible pandemic.
Great. Have you thought about anything that you are going to be doing after you get your second shot, 2 weeks after your second shot when you're fully vaccinated? Anything you're looking forward to?
No. I'm going to Disneyland. No. Look, I'm going to still wear my mask. I'm going to still socially distance. I'm going to still observe the necessary protocol that will protect us, but I'll feel safer. I'm protecting other people and protecting myself. But I'll feel so much better. I mean, I might go out to a little restaurant, get me something to eat, still socially distant, and be able to, in my heart, know that I've done everything I can to both protect myself and my family, but also, not only other Americans, and I'm interested in all Americans, but especially Black Americans, because we are so besieged disproportionately by this horrible virus.
Well, it's funny you said restaurant. That was one thing that my husband and I did. We actually did once we both fully got vaccinated. 2 weeks
where'd y'all
after,
go? Get some ribs? No.
No, we went to a seafood restaurant. It was good.
All right, nice. Yeah, no, I'm gonna go out here and go to a restaurant and hang out and say, hey, give me my food because I'm fully vaccinated. I have adhered Dr. Clarke's advice and Dr. Kasai and all the other good people, who are really trying to make sure that our community is vaccinated, is protected, that we get rid of the conspiracy theories, that the skepticism that we have, understandable and legitimate, has to be met by the force of scientific knowledge and medical knowledge to make certain that we are protecting each other.
Now, I'm concerned, though, you talk about scientific knowledge and that is wonderful, but I'm concerned about our 18 to 40-year-olds who right now in many states it's opening up in terms of eligibility. I think 14 states now, people who are 16 and older can actually get vaccinated. So, there have been polls done and they don't really care what doctors have to say. What would you say to, the 25-year-old who, feels invulnerable? I mean, a lot of 18 to 40-year-olds listen to what you have to say.
Well, bless you for that. Let's do this. Let's have a versus. Let's put COVID-19 on one side and Black people symbolically on another, and just see how we get our butts eaten alive. I mean, the thing is that, we watching the Isley Brothers and Earth, Wind and Fire last night. I'm going to
fantastic.
Check it out. Oh my God. I mean, two of the coldest ever. I mean, two of the greatest falsettos in Ron Isley, 79 years old with his beard. macking out. He's still setting thirst traps out there. And
Oh,
still
yeah.
a baby,
Yeah.
well into 60. You know, reasons, the reasons that we're here. I don't know.
I
So
told you he
got,
sang. I told you he sang.
then you got Ron Isley out here talking about make me say it again, girl. I mean, so when you think about
Yeah. I thought you were going to do Contagious. I mean,
oh, look at you. You got all the jams out there. So here's the thing, though. That would be appropriate, though. So here's the thing. We have got to tell the 18 to 40 years old, you are not invincible. And you think you can't get this? You are getting it. And you are dying from this disease. And you are being besieged by this virus. This virus is no respecter of persons. People who are 8 to 80. People who are young, people who are physically fit, people who are doing well have gotten this disease and died. So please don't think that you are invulnerable, that you are invincible, that you somehow can shake this disease off and you'll be fine. So I think we need to go to churches. Again, we need to redouble our efforts. We need to have LeBron James and these basketball stars and these football stars and these people talking about it. I think we need more public service announcements from the NBA and the NFL and other athletes, because they've done a great job, especially in the NBA, of protecting themselves, relatively speaking, when they had the bubble last NBA season. So the thing is that we need sports stars and entertainers and others out here saying, look, we have got to get this vaccine. If you have the possibility of getting it, please get it. And 18 to 40, go to churches, and these churches, these ministers, these deacons, they need to be passing out, information on the offering plate as they pass it for offering. Here is the disease. Here are the facts. Here are how Black people are disproportionately dying, and we have got to combat it. So I think we need PSAs from entertainers. I think we need church people and ministers and other people talking about it. And I think we need peer-to-peer. I think we need young people in organizations, whether it's the NAACP or the National Action Network or, NAACP Legal Defense Fund, whatever it is. And some of these young organizations, medical organizations, scientific organizations, lawyer organizations, all professions, and sororities and fraternities. We need them out there on the front line delivering that message, saying you can't say ski-wee or whoop. And I'm sorry, I don't want to be, please don't be mad at me, y'all. I know that's y'all's, the Deltas and the AKs. I don't want to, God forgive me for that, y'all. But I'm saying, we'll let you also slide. Saying that, bless you, right.
You see that also, elephant over my shoulder.
See, that's what I'm trying to say. But the sororities and fraternities need to be out here promoting a message of Black vaccination, of Blaccinated, along with our politicians and other leaders as well. Yeah. All those folks need to get involved to convince our young people that they need to take that vaccination.
Yeah, and I think those are great points. And I wanted to mention the Leadership Council of Healthy Communities, of which Pilgrim Rest Baptist Church is a part, have been out there in the front of the fight. So I think a lot of those things that you mentioned, hopefully, actually, I know are in the works. And we may be calling you up for a PSA. So keep your calendar open.
I'll do it.
So, you recently published a book, long time coming, Reckoning with Race, and you open up with the death of Elijah McClain, who was a 23-year-old healthcare worker. He was a massage therapist, actually. And just like his death, and Michael Brown and Sandra Bland and Breonna Taylor, unlike them, the death of George Floyd seems like it was a wake-up call in a way that we have not seen. But do you think that if it wasn't for COVID, America and the world would have paid as much attention to it, and because we were sort of in a way sort of glued to our TVs because we weren't out doing other things?
Yeah, I think it's a great point, Doc. I think there's no question that the quarantining of COVID, the forced cohabitation with others, and living in our cycles, our silos, our virtual realities. 2 weeks before that, we get off of that darn phone, young man, and get out there and talk to people. Now we depend upon the phone and the computer the very things that we thought were the bête noire and the horrible technological, distractions from real community and intimacy. Now we depend upon them to do it. People go to their doctors in virtual reality. They talk to their loved ones. They speak to those who are in the hospital. Sometimes, unfortunately, they say goodbye to their loved ones on a computer. And sometimes even, speaking to your therapist and the like. So these instruments of intimacy have been crucial in mediating and bringing to us images and realities that we are, that we would otherwise ordinarily perhaps not necessarily take in as aggressively as we have. So yeah, there's no question that being at home, being quarantined, looking at our, surfaces and looking at our screens made us more susceptible to the image of George Floyd flooding our screens. And we were paying attention more. We were looking more. And the images from that Facebook posting got sent around and went viral very quickly. And that made a huge difference. And we were at home going, what the heck is going on here? And I think it made a huge impact. Many white brothers and sisters saw that and said, no more. There are no more excuses. I mean, before it would be like, well, he was running from the police. Nope, he was on the ground. Well, he was being belligerent. No, he was saying, yes, sir, and no, sir. Well, he was being, a threat to the, no, he was in handcuffs and the man had his knee on his neck. And the policemen, 3 of them were on him. And so I think that catalyzed an awareness that made a huge difference, that led to protests in the streets, that led to reckoning with race in America in a way we hadn't done before, and has led, I think, to grappling with history in a much more palpable, a much more tangible fashion. And now we got the trial of Derek Chauvin, and the evidence is overwhelming that this man is guilty. I just hope and pray that the jury follows through and that he is held to account for the death of Mr. Floyd.
Well, you and I certainly hope so too. You actually mentioned after you got your shot, which was amazing that you just off the cuff, just having gotten your COVID shot, said some really profound things. And one of them, just was the need to get vaccinated, not only against the pandemic of COVID, but the pandemic of racism. And COVID has really sort of brought to bear, especially in healthcare, my discipline, just how lopsided our systems are, especially our healthcare system, but access to jobs, insurance, education, healthy food, safe housing, all these disparities show up in worse health for our community. So how do we make sure that the time that we are going through right now, where everybody's, fixated on the disparities in society, how are we going to make sure that we sustain that past this time, once the pandemic is over and we've moved on? How do we keep that momentum going?
No, it's a great point. It's a great question. And I think that, paying attention to valued professionals and leaders in the medical field like you, people who have a conscience and who have a contract, a Hippocratic oath, first do no harm. Well, the harm can't just be physically to that particular person. It can't be to your latissimus dorsi or your pectoralis major, or your gluteus maximus, or your, I don't know. That's all I know. So, and whatever bones and stuff and muscles you got, it can't just, you got to treat the whole person, and then you got to treat the whole neighborhood, and then you got to treat the whole community. Then you got to treat the whole race. So that those things you named, if you use the emergency ward as healthcare maintenance, you're in trouble, because by the time you get to the emergency ward, years and years of accumulated, unhealth results in you don't have routine access to checkups. And then when you do, they've done the racial differential. Even when you control for class, Black people say Black and white person making $150,000 a year each. Each of them goes to the doctor. The white person has more aggressive treatment if they have, say, heart disease than the Black person, even if they're rich, even if they're wealthy. And
that's well documented in the medical literature. Well documented.
Yes, ma'am. Thank you. And then they just did a study, about a couple months ago, that said infants have a better chance of survival who are Black if they have a Black doctor. Now, that doesn't mean that the white doctor's going, I hate you little Black kids. It means that if there is a disease or a problem, the curiosity of a Black doctor who might identify, that could be my son, that could be my daughter, that could be my neighbor's daughter, that could be my grandchild.
Yeah,
exactly. So
they'll listen more to the mom. They'll value more what she has to say. They'll pay attention. Absolutely.
There it is. So when you deal with all that food deserts, you got high sugar content cereal in these ghetto grocers. They ain't got whole foods. They ain't even got half foods. They ain't got quarter foods. They ain't got no food. And then when you think about the fact that you got the mystery meat and all the horrible stuff to which Black people are subject, so that their diets are jacked up, and that leads to diabetes. Because when people say, well, why don't Black people take better care of themselves? Well, they would if they had routine access to health care. And if the darn ghetto grocer wasn't messing up their health and then putting on extra weight and diabetes and hypertension and heart disease and the like, this stuff is driven by lack of access to, goods and services and high quality foods that allow Black people to eat healthy. It's more expensive to eat horrible stuff than it is to eat healthy stuff. So when we put all that together, we have got to hammer that point home. We got to make sure that, we support tremendous physicians like yourself who are concerned about the community. We got to talk about food deserts. We got to talk about access to high quality foods and foodstuffs and stuff. And then we got to talk about, the ability to maintain our psychological health in the midst of a racist culture that refuses to acknowledge our humanity. This is a holistic approach that we have to have in order for us to be healthy.
You hit the nail on the head. And right there, I am actually going to see if my co-producers, Lila and Wayne, have any questions from the audience. And right as they're coming on, I'm going to say racism, just as you closed, is a determinant of health because it causes extra stress that other people don't have to deal with.
That's so true. Amen, Doc.
All right.
So Miss Lila and Mr. Wayne, what you got?
We definitely have some questions. You want to go for it, Wayne Bruce?
All right. I'm going to go first. First, I want to say thank you, Dr. Dyson, but I also want to say I've gotten about, see, people don't necessarily post in the comments. They'll post on my cell phone. And so I've gotten quite a few texts that said the D9 and the Black fraternities and sororities are present. And that comes from someone of literary note, Miss Sonia Ross, who is personally,
no doubt,
author, news reporter.
Black Women Unmuted.
Yeah, right.
No, Black Women Unmuted. Okay.
Very good, very good. I'm glad the Divine Nine are out there. I'm glad they're out there doing their thing. We just need more.
That's right. We are.
So we have a question. We have quite a few questions from Yvonne Smith, but I'm going to take one that I think is prominent. How do we reach people? She writes, how do we reach people who are less formally schooled in addition to personality?
Well, you got to go to these churches. A lot of people who are illiterate, less educated, not capable of reading or read at a lower grade level. That's why we do the announcements. People be wondering, when we go to Black church, dang, is it written in the darn bulletin? How come you keep reading? Because everybody can't read, bruh. So we got to say it for them. We got to make the announcements because everybody could not have the same level of access to educational pedigree that you might enjoy. So first of all, we got to put it in the announcements at church to make sure that we reach people. And then we got to do these PSAs. I think these PSAs are extremely important, that people that they find who are trustworthy, like Dr. Clarke, or for you, Brother Bruce, or Sister Lila Mays, Black people who have, or Miss Ross, people who have portfolio in community need to be listened to as well. And it doesn't have to be a formal PSA, but to make an announcement on your social media, a third outlet, right? People need to use what's available to them and to go out there and to promote the healthiness of, Black people getting their vaccines and making certain that Black people are getting shots in arms and not being left behind. And then finally, I think what's extremely important is to talk about how we can get some of these radio announcers, and I'm sure Steve Harvey is already deep involved with it, and whoever is in place of Tom Joyner and the like, to get our national radio shows geared toward making these kinds of announcements and reminding Black people. I mean, if we can do all kind of nice hilarity and goofiness and plays and stuff that we do on radio shows, let's also do the seriousness of making sure that our Black people are helped and vaccinated, and as they get out, put it in the local restaurants, put it in the local barbershops, put it in the local cosmetology where they get their nails done. All these places are critical to communicating that message to every level of Black person in society.
And I just that's great. You brought out some wonderful points. 17% of the DC population is illiterate. That was of those who come to the emergency department. Let me say that was a study that was done. And so it is no joke in terms of making sure that we reach people using auditory means and not written means. And I just want to say too, shout out to Russ Parr. I've been doing his show for almost a year now as a medical contributor, and we talk a lot about COVID. I mean, 90% of the time we talk about COVID. So I think he and others are stepping up to the plate, just in the way that you said.
Beautiful, beautiful.
So,
Lila? I'm going to read a question from Alexis Proctor Kellum. There are African Americans who are skeptical about putting Black on the vaccine form because they believe there's a Black vaccine and a white vaccine. How can we assure them this is not true? Let's debunk that right quick, Dr. Mill and Dr. Dyson.
Let me go first because I know Dr. Mill.
Go ahead.
She got the $. I'm just going to be fun.
Right, go ahead.
Bro, please. You better get a Black vaccine, and it's a Black seed because the Black woman, I got the Black seed, I got the Black one, Moderna, that the Black woman hooked up. But let me tell you what, it's Black if it's going in your skin. It's Black if it's going in it's a Black vaccine if it's going in your Black shoulder. So look, it ain't got no color. You got to make sure the color is called success and survival. Now I know Dr. Mel got the real stuff, but I'm saying don't let people, the same Negroes who told you not to buy the lottery ticket, the same Negroes who told you not to go on a date with that person who's been married for 35 years, somebody else, the same person that told you not to stand up in church and accept Jesus, and then they've been preaching for 35 years, and you've been out here just hustling. Okay, I'm sorry, but what the point is,
come on, Dr. Dyson, come on, Dr. Dyson.
The thing is that don't be listening to Negroes or other people who ain't got no knowledge. Wait a minute, are you a physician? Are you a chemist? Do you do biochemistry? Do you know the interaction between, the psychodynamics of, the brain and the physical properties of consciousness? What the hell you talking about then, bruh? You let Negroes who don't know what they talking about mislead you and keep you from your blessing. I'm sorry, I just had to say that.
Sure.
Well, coming after that, I think we could probably do a good cop, bad cop thing here. So, so basically, it would be extremely difficult to try to segregate vaccine doses, all coming out of the same location, first of all. Secondly, I hear a lot of the conspiracy theories about how the vaccine is a Black vaccine. They don't really need to come up with a vaccine to harm Black people, because 2 to 3 times we as Black people are dying of COVID. They don't need anything else to kill us. So
come on, Dr.
when
Mel.
when we are being offered the vaccine, we need to take it, and we don't need to worry about the fact that it was designed to kill us, because this is a worldwide problem. And I don't know if y'all realize that when you turn down a vaccine here, remember when you were little and they told you to eat the food on your plate because there are people starving in India or wherever?
Right.
It's the same thing with the vaccine. There are people worldwide who would kill to get the vaccine. And here we are being offered it, being chased down the street for it to be given to us, and we're refusing it. So no, there is no grand plot for a black vaccine and a white vaccine. No such thing.
Okay, we have a question coming from, once again, wow, bringing up her name. Sonia Ross has a very good question for Dr. Mel. Hey, when is it safe to get a mammogram, before or after the vaccine or between shots?
So great question, Ms. Ross. So with the mammogram thing, what happens is the vaccination, any vaccine, not just a COVID vaccine, can cause lymph node swelling, what we know as swollen glands under your arms. And when they look at a mammogram, they're actually looking to see if you have swollen glands. And let me just say, those swollen glands from the vaccine are temporary. They come and go. So the recommendation is that if you're going to get a mammogram, wait 4 to 6 weeks after you've been vaccinated to make sure that there are no swollen glands as a result of the vaccine that might be confused with signs of cancer, because swollen glands also happen when you get cancer. So either get your mammogram before your vaccine or wait a month afterwards to get your mammogram.
Okay, we have another question coming from Pamela. Where is it? I'm sorry. Pamela Candidate Chapman. How are you? She asked, what can we do for a campaign for young people between 18 and 40, and they're opening up vaccines for youth at 15. What can we do? Do we have any information on that?
So I think Dr. Dyson really ran down, because I asked him that question, really ran down all the different ways that we could reach young people. The one other thing that I would add is schools. You know, schools, and when we get to the 12 to 16-year-olds, which are not approved yet, but they're finishing the trials and they're going to be applying for emergency use authorization, going to PTAs, going to schools, talking to parents and children at the same time about the vaccine and about the decision to take the vaccine, I think also has to be part of the campaign as well. And I've actually done a number of discussions with school groups around the country just about COVID and about COVID prevention. We haven't talked about the vaccine yet, but I'm pretty sure that's coming.
Actually, Rhonda Walker has a question. Her question is, myth or truth, does getting vaccinated keep you from contracting COVID?
No. I'm Dr. Dyson, and no, it doesn't keep you from contracting it, but it does mitigate against the most severe consequences that would attend that disease, and therefore you have a better chance of survival.
Very good. He nailed it. So actually it does keep, it is effective 94% of the time if you get the Pfizer or Moderna vaccine from getting COVID, moderate to mild COVID. The Johnson & Johnson is 72% effective against mild to moderate COVID, but it's 100% effective against severe COVID and 100% effective against dying from COVID. And there's also a question now, there's a study that just came out of Israel today that shows that people who have been vaccinated actually have if they do get infected, they have 4 times lower amounts of the virus in their system. So it's less likely that they will pass it on. So that question about spread. So that's still, you know, that jury is still out there. You still got to wear your mask. But even that is good news in terms of the amount of virus that builds up in your system. If you are vaccinated, it's very low, and which is probably leading to less severe infections or no infections, asymptomatic infections.
Okay, we have a question coming from C. Renee Tucker. I did what I was supposed to do, received both shots, and now I have right side face numbing, arm and leg with dizziness. I just had an episode 10 minutes ago. Is this my body detecting the virus, or should I seek medical attention?
You should absolutely seek medical attention. And again, one of the things we talked about in the debunk was just because something occurs after you get vaccinated doesn't mean that it is directly related to the vaccine. So if you're having new symptoms that you've never had before, you need to go get them checked out, especially if it's numbness and some of the things that you described. Absolutely.
Okay, so this comes up often when we are discussing the vaccine. It isn't a question, it's more of a statement, but it'd be great for both of you to speak to it. This is from Nicole Gibson. I'm scared because of the Tuskegee experiment. I just don't trust it. I'm a nurse, and I know this concern is just because of fear. How do we?
Dr. Dyson, you want to take that one first, and then I'll.
Yeah, I'll go first because since you know what you're talking about, I'm just going to be talking. I'm going to just be talking. Well, look, we know that from, was it 32 to 72? I mean, it was a long time, right? That
40 years.
Yes, that Black people were experimented with in an unconscionable way, without informed consent, without being told. They were trying to determine what would be the outcome of untreated syphilis in a human being. And so in Tuskegee, Alabama, these unconscionable physicians and nurse, I'm sure y'all saw the HBO docudrama about this, who was involved, did horrible things, and it had horrible consequences to Black people. And that wasn't the only case. It's the most famous one without informed consent. But we know Harriet Lacks with her immortal cells up here in Baltimore were harvested to billions, making millions upon millions of dollars for everybody except her family, although they've tried to change some of that now. But again, without telling her and without informing her. And so there has been medical abuse of Black bodies. But as a nurse, I would hope you would understand that, again, it's not medicine, it's physicians. It's not science, it's scientists. It's those who appropriate it. The same sun that melts wax can harden clay. So the thing is that it's not the medicine, it's who's doing it, who's using it, and for what purpose. Now, here's the difference. In Tuskegee, they withheld medicine that could help us.
Right.
Now we're trying to give you medicine that's going to help you. This is the opposite of Tuskegee. This is Tuskegee in reverse. We're trying to beg Negroes and Black people and Africans in America to take medicine. So please allow your scientific, region of your brain, the left brain or whatever, to be involved. The medulla oblongata, take your cerebral cortex and all that brain power and understand that this disease can only be defeated by vaccination, and more vaccination, and Black people being vulnerable to this disease. Think about it this way, sister. I'm going to let Dr. Clarke take over. If you don't have a vaccination, we've seen what happens when many Black people get this darn virus. They die. At least take a chance and go, you know what? It makes more sense in terms of me, quote, gambling with my life. Let me go on and take the particular vaccination. And at least, even if I have some allergic reaction to it that can be contained because doctors will be looking at me, it won't be nearly as destructive and as pathological as dying from a disease that we had the ability to prevent spread, but yet we didn't. But I'll shut up there, and I know Dr. Mel got the real stuff.
Well, that is some real stuff right there that you said, but I am going to throw something on top of that. Number one, the thing about Tuskegee is, and about all the things that have been done to us unjustly, is that it has taken away our feeling of being empowered, our sense of agency, our sense of control. But there's something that we need to understand about vaccines. Number one, vaccines were introduced into the United States by a Black man, by an enslaved African. Number one, the whole concept of vaccines and getting inoculated. Smallpox epidemic in Boston in the 1720s. Number two, Dr. Dyson has already alluded to her, Dr. Kizzmekia Corbett, one of the lead people who helped to develop the Moderna vaccine. There's doctors who have been involved who are African-American all along in the process of examining the evidence around this vaccine, testing it, and making the decision to approve it. Your personal doctor and many Black doctors, the National Medical Association, the Black Nurses Association, also who have looked over this data and would not recommend something to you if they have not already taken it for themselves. Like, I would not be up here talking about it if I had not already taken it for myself, if I had not already recommended that my mother take it. So again, this is offering treatment that over 143 million people have gotten, and it is not shown to be killing people or making them sick. It's actually showing that it's helping keep people out of the hospital. So I'm not sure what other evidence is needed, but it's clear we don't have measles, we don't have mumps, we don't have polio, we don't have smallpox. All these things have been because of vaccines.
Okay.
Right.
I hate to interrupt you, Dr. Clarke. We have a speed round going on now.
All right.
So
we're winding down.
2 questions, same kind of question, different sides of the coin. KCH says, can COVID-19 infection cause male infertility? And we have a similar question from Victor Freeman. Should pregnant women get the vaccine?
Okay.
Similar.
So COVID-19 has been found in sperm cells. It's unclear whether it can cause infertility or not, but it is known to be in sperm cells. And then as far as should pregnant women get vaccinated, thank you, Dr. Freeman, for that question. It is the Society of OBGYNs, the doctors that take care of pregnant women, have come out and said that pregnant women should have the vaccine made available to them because pregnancy is a risk factor for severe COVID, for mothers ending up in the ICU, for preterm birth, etc. And so to guard against that, they're recommending that pregnant women have the decision to be able to take the vaccine. The trials are still ongoing, but even with that, they feel that the risk of getting COVID outweighs anything that could happen in terms of getting the vaccine. So they recommend that their patients have the opportunity to get the vaccine.
Okay. We got Marv West. If you need surgery, can you do this between the first and second shots or after the second vaccine only?
So I would say do that, make that decision in consultation with your surgeon. One of the side effects of the vaccine can be fever, and we want to make sure that if you have surgery, that if you get vaccinated with COVID and you have that as a side effect, that it's not confused with an infection from the surgery. So you also want to make sure that if you are on some kind of medicine associated with the surgery, that it's not going to interfere with your body's ability to respond to the vaccine. So you want to just make that decision in conjunction with your surgeon, with your doctor, in terms of the timing of the vaccine.
Lila Mays?
There's a question from Thurston Randall Jr. Are any of the vaccines effective against the new variant strains?
Yes. So that's the whole thing with the Johnson & Johnson vaccine. It was tested against the South African variant and the Brazilian variant. It was found to be effective. And now they're also saying that it appears that Pfizer and Moderna is definitely effective against the UK variant for sure. And it looks like it's slightly less effective against the variants, but still nevertheless effective. And I think we're just going to take one more question and we're going to wrap up.
One more question, and it's a great question because it deals with kids, young people. If the CDC, it comes from Victor Freeman again, if the CDC says kids can be in class with masks 3 feet apart, with good hygiene, social distance protocols, and good ventilation, God bless y'all, then if teachers get vaccinated, why can't we get more young kids back in school?
So we can, and just to be clear about that 3 feet distance, Dr. Freeman, that's only in areas where community spread is low, below 5%. If you're in a hot level area of high community spread, it's still 6 feet apart. But yes, that's the whole purpose of the CDC revising its guidelines, trying to get kids back in school in a very safe manner. And those schools that adhere the letter of the law to exactly what those guidelines are seeing people successfully go back to school without a spike in infections. And so thank you to Reverend Dr. Dyson. I know it's late, but you have still brought it and given us some wonderful pearls of wisdom. Thank you for sharing your vaccination journey. We really appreciate you.
Thank you, Doc.
And absolutely. And you know, we've learned a lot tonight. We've covered a lot of ground. But I think it's really important, you know, as we talk about Blaccinated, vaccinations in the Black community. Remember, when it's your turn, if you're still unsure, there are resources in the community you can reach out to. You can go to your Department of Health. You can go to your regular doctor. You can go to the website for the Black Coalition Against COVID-19. You can certainly come and sit with us at 9 o'clock at night and we'll answer your questions live. But when you have the opportunity, please take your shot because that's the way that we're going to get out of this pandemic. And I want to thank my co-hosts, my co-producers, Lila Mays, Mr. Wayne Bruce. Thank you so much. Again, I'll be on the Russ Parr Morning Show tomorrow morning at 8:50 a.m. Please tune in. And I will be right back here next week at 9 o'clock waiting for you to come join me. So until I see you, remember, be wise, be well, and be health empowered.